Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
Hello, this is Frank Cutitta with Health Stealth Radio. We'd like to welcome you today, broadcasting on Healthcare Now radio syndication. And it's always a great pleasure of having our government affairs team with us today. It's no one ever thought government affairs could be so fun until you got these two characters with you. So, Chelsea and Mari, we welcome you. And, this is the question that everybody's asking right now, like what the heck is going to happen on January 6th, other than what happened the last time we had a January 6th. Wanted to get your point of view of what you're doing with CHIME on the government affairs side. And just to kick it off, everybody predicted that this could possibly happen, and then it did happen. So how much were people caught on their heels in your business, and what are the implications that you see right now, just at the onset, not even really looking at specific issues that we're going to talk about later in the show. So who wants to kick it off? Mara, you want to start, or just what's the reaction to this whole thing?
I'm happy.
I was going to let Chelsea go first, but I mean, I'll just say one thing short, and I'll hand it over to Chelsea. I think people are still getting used to the change, and I call it the ground is like shifting underneath us from a policy standpoint. But I know you have some extra context you want to add, Chelsea.
Yeah, I would just add that people follow polling and all of that up to the election, and they predict, and there are even election pools, which I may have won a few of them here or there in the years. But this is an outcome that it shouldn't surprise anyone. Your personal feelings shouldn't matter. We just get to work. So I think that, I personally wasn't surprised. I think Americans spoke, and this is what we've got now. So we're looking forward to getting started sometime in January after the inauguration.
Well, that's the whole point. It hasn't really even started yet. There's still something left. So I'm curious, in your business, I mean, how much meaningful work could possibly get done? And will there be things that they want to try to stuff in before January 6th that have any possibility of staying alive after that?
I mean, we could start like the online policy betting. Chelsea seems to have already opened the door to that. So, I mean, I don't know. You could wager some bets on what's going to happen. I mean, I'd like to see, like, the better question is like what's not going to get clawed back from this incoming administration. I think there's a lot of things that are on the table, and Chelsea, jump in here.
Yeah, I think HTI-2, part of that final rule actually came out this morning. So they are still pushing things out. And that was a bit of a surprise. I haven't had time to read it all yet because it was, an hour or so ago, but it is solely focused on the TEFCA pieces of that final rule, which I think they're hoping, if I had to guess, cement the TEFCA pieces in hope that, it just flies under the radar as not significant, not controversial, may not be, withdrawn, or it's not subject to the CRA because it's not major or economically significant. So, if no one complains, it might not garner a lot of attention and slide by. But there are regulatory freezes issued on day one where they stop everything and review things that have been done and kind of just reevaluate where they're moving forward. So I think pretty much anything they put out could be just clawed back. So that's why I don't think we're going to see things that are currently under review, like the HIPAA security rule.
For those who aren't policy wonks in the audience, could you tell us what those acronyms you just mentioned are? HTI?
Oh, I wish I could remember what HTI is for. It's really, really long. health, it has to do with the interoperability pieces. There's
Okay, all right.
HTI 1 and HTI 2. These are rules from the Assistant Secretary of Technology Policy, ASTP, Office of National Coordinator for Health IT, ONC.
It
Thank you.
rolls off the tongue.
It really does. There's reason for acronyms there.
I mean, I think anything that is released is, in some ways, like they're trying to cement legacy, right? If they are pushing things out the door, and that under I want to say normal, like there's really nothing normal about today, but I guess we're getting further and further away from normal. But typically the outgoing administration will like push things out the door rapid fire. We saw that slow down as of this summer, but it was not normal. Like the Chevron decision hit, and I think that kind of created some stickiness and pausing that really hampered the current administration's ability to move things as quickly out the door as they would have liked to. I mean, we could get super nerdy here, Frank. I mean, we're really good at this, right, Chelsea? Like we're super good at being nerds. Congressional Review Act. I guarantee most of your listeners are like, oh my gosh, don't even get into this. Like, basically, it's just a tool that an incoming president can use to claw back stuff they don't like. Okay, said the easiest possible way. There's a lot more details and a lot more I's and T's that I could cross, but I'll just leave it there. And so there is a look back period, and so if it falls, like within that look back period of 60 days, it's certainly easier. If it's outside of that, then it gets harder. And so HIPAA, for example, HIPAA security rule, the much widely anticipated, we like prime the pump on this all year long, 2 years maybe, didn't make it out the door. So if they do send it out the door, it's going to be like a legacy cementing thing.
And I think
does it make sense?
Ripped apart, yeah.
Well, the possibility of getting it will get whacked when it goes through. Right?
Absolutely.
But that's not it. Just other administrations, pretty much every administration in my career has done the same thing. The Biden administration rolled back previous Trump administration, so it's not specific to this.
Absolutely,
to President-elect Trump. It's not.
They just want to put their own fingerprints on it, right? I mean, honestly, the HIPAA security rule. I mean, there's even legislation that's being considered that would call for reopening the HIPAA security rule. Like, it's entirely conceivable that, given all the cyber attacks, that Trump could reissue. He hasn't been issued. Like, it's final. It's out there for many years, but he could put his own stamp on things. Yeah, that's not, I think, off the table.
Revise it, rewrite.
Revise it, right? We haven't seen it. The utterly mysterious. It's at OMB. Chelsea stalks the Federal Register. Again, wonky, but it's the place where rules go to the White House to get reviewed. Said the easiest possible way before they hit the public.
99% of the time, because the rule that came out from ASTP ONC this morning regarding the TEFCA piece of HTI 2.
I want to get that sentence down so we could get the
Could you get that down? ASTP ONC? Say that 5 times.
To work on that
Exchange Framework and Common Agreement, TEFCA, it did not go under review. So it just slid right out. And that was surprise.
Huh.
So,
interesting.
Yeah, it was interesting. There were some interesting threads back and forth, like how and why.
So the other interesting thing is this whole efficiency group that is being brought in, which is, needless to say, it's controversial, especially considering the characters that are running it. Characters I'd use nicely, I guess. Maybe not. But what do you think that probodes in terms of efficiencies? What do they go after? What's the big target, or is it just overblown that they just want to send a signal that it needs to be done?
If you're talking about DOGE, the Department of Operational Government and Efficiency, not a real department, by the way. It's just in name only. I do think that, my colleague Cassie shared with me this morning that there's a Senate caucus on DOGE, and the House is considering starting a subcommittee on it. So there may be some teeth there with the recommendations that they come up with. It'll be interesting, I think, for us to see what they do with, requiring folks to come back in person to work, and if that is in reality something that is feasible or will work. I think kind of policy-wise, anything promoting innovation and deregulatory in nature is possible. Mari, what do you think?
Yeah, I think anything that is unfunded mandates in general, costly, economically significant. Hold on, DC term, economically significant just means it really expensive, isn't like 200
more than
million
200 million.
A lot of money.
Mhm.
So there's a lot of things that could happen. I mean, we're taking it seriously, and then back to Chelsea's point about the pieces that are kind of moving on the Hill that are like, you know, like the caucus and some of the bills, like they're looking for savings. And so I think, you know, that we are going to pay attention to some of these areas. It will also kind of tie into the budget situation. We do not have a fully funded government. Oh yeah, newsflash everyone. The government funding runs out December 20th. Again, super inside baseball, but we do like the US government to keep working. They're the largest employer in America. So December 20th, lawmakers are expected to extend it in shortly, like do like maybe into March-ish. That's the latest. It could change. And then once they get past the inauguration, get into March, then the Republicans will have full control of both chambers and the White House. Then they can really put their mark on spending. And so that, I think, is where everybody needs to be really paying attention to where the dollars and cents are, like which agencies will receive a haircut. We'll be obviously watching for that.
I think it's worth noting there's slim margins in the Senate and pretty slim in the House as well. So they will need to have some bipartisan support if they want to, really go with, if it's going to be extremely partisan, it's just not going to fly and it's just going to be held up, and hopefully they can, reach across the aisle and get some folks and get a package out that's a little bit longer.
Yeah, and this return to the office thing, like there's the vision and then there's the reality. Unless you think that federal employees are going to be like snuggling and sitting in each other's laps in terms of like sharing shares, because they shed a whole bunch of buildings and leases. Sure, yeah. There simply are not enough seats in the US government, at least in DC, for everyone to come back all at once. So that is not really a realistic, at least in the short term scenario, no matter what anyone says. We know like that for a fact for the agencies that we work really closely with. So again, unless they're like going to be sharing a chair, it just doesn't seem very realistic.
It's such a great stat. There just are not enough chairs to go around right now. Standing room only.
Servants. So I mean, tempt them to leave, and why wouldn't they?
And and a lot of government. I mean, I know it's sometimes federal service, but there's the people that we work with work really, really hard, and I think it's worth at least giving a shout out to them. Like these are hardworking people who know how the government works. Not to say that we can't have more efficiency. Oh, I'm sure we can, but there's a lot of people who do work really hard in the U.S. government.
Mm-hmm. Absolutely. So without getting into specific politics, are there any things that you see that a more conservative government like will be coming in could be a benefit for healthcare technology policy that we didn't have during the Biden administration or even going back to the Obama administration? Are there things that they view differently, which we at CHIME Government Affairs agree with?
It's hard to find some right now, but like unfunded mandates, Chelsea, what do you think about those? Do you think this will be more scrutinized?
Yeah, I agree.
So tell it again for our audience, for the subtitles. Unfunded mandates means
no money from the government to help you implement what they envision being a mandate. They're not like
it means exactly what it says.
Money to help
you're required to do X, but you have to pay for it.
You come up with the money.
So do the Republicans or do the conservatives think differently about cybersecurity and about artificial intelligence than I should probably know the answer to this than the previous administration?
I think Republicans, as far as cybersecurity, we do have a champion in the Senate, Senator Cassidy, who will be heading the Help Committee. And he does want to include some funding in a recent cyber bill to help our members. Mm-hmm. Is it enough? But at least he specifically, as a physician, wanted to put money in there to help hospitals. So That's a good indicator for us. But generally, there's an agreement that something needs to be done, but spending money on it is a whole nother issue.
Yeah, right. Okay.
Yeah, like for example, I mean, the counterweight to that is Senator Rand Paul, who will be chairing the Senate Homeland Security Committee, and he is not a big fan of CISA, which CISA works in conjunction with all the major agencies and departments. Like in the case of health, it's HHS, right? Mm-hmm. And they do offer, strong services, and our members do use them. I don't know that CISA is going to like go away per se, but we will, just back to my earlier comment, be looking at like their funding. Mm-hmm. And so, I don't think he's going to be a big fan of mandates, for example, but there's going to have to be some meeting in the middle. So maybe we don't get the mandate, but we don't get the funding, so right. It'll be a negotiation.
It would be nice to have some assurance on, are you going to regulate AI or not? Because that's what I've heard from our members is this is a large ROI, like a large initial investment, and they want to make sure they get that ROI. Mm-hmm. And without knowing if it's going to be regulated, if there's guardrails, what's going to be happening in the next, 6 months to a year, it's hard for them to make those choices with limited funds available. But it would be nice to know the direction, and hopefully we'll see that.
How bipartisan is AI?
I think it's, as Cassie would mention, there are 118 bills in this Congress with the word AI in the title. So I think that
118.
Yeah. So I think that it is bipartisan, and the approaches may be different. And also the use of AI in what industry. I think that varies as well.
Yeah, I just look at what's happening with TikTok. So it's surprisingly bipartisan, and based on fear of capturing data by the Chinese. So just curious how much of that carries over into other areas like AI, and I think you've answered that. So membership value from CHIME's point of view. What is most of your time being spent with interacting with CHIME members, and what are some of the things that you're advising them on at the grassroots level? I mean, you're operating at this policy level where, again, people like myself have to ask what the acronym means, and then you just say, okay, here's the translation, and here's what it means to your enterprise. Are you dealing with a lot of government affairs people within the providers and even in the vendor community to help them navigate through this?
I can start, Chelsea, and I'll let you jump in. The little known day in the life of a registered lobbyist, which is what Chelsea and I are, is like a lot of reading and writing. Our entire job centers around digesting and ingesting in a tremendous amount of, it's like a fire hose. The government's squirting stuff out like all day long. And it's just a torrent of information. So you have to quickly parse through it. And our job is to, discern like what really actually matters to the member and then translate it. And Chelsea does a lot of the translating.
I try to translate those regulations into at least somewhat plain English.
The dummies, they used to publish a dummies book, so the dummies versions, in all the due respect. And I think the other thing that's to your advantage is that we write about this and do it in our website. Governance has sort of become cool again. It used to be, I'm sorry, but I'm calling in sick on Governance Day. And now it's like AI governance, cyber governance within these enterprises. And we're trying to figure this out. And the board's saying, we need to figure out what our cybersecurity governance is and how we implement AI. So it seems to me that some of the things that are a little bit more wonky are sort of translating into the governance aspects of these enterprises. Are you finding that?
Yeah, and I think it's an individual journey for every individual healthcare delivery organization. It's their own journey, and we give them as much knowledge as we know, and we also get their input. Like our team's going to be doing a survey. What do you want to see if there's like a regulatory reduction in burden, like a deregulation? What do you want to go, and what do you want to stay? So we make sure things that like they care about and are important working for them stay and aren't just ripped apart because no one said anything. And so that is something we're going to be asking all of our members to weigh in on. Like, what's the little things and the big things that are keeping you up at night? It's open-ended, air your grievances. And then we'll share that with the administration. And
so that it begs the question. It might be a blinding glimpse of the obvious. What are the ones that they want to stay, and what are the ones they want to go away? Are there just a few examples?
I'd love to know from them, but I think there are some easy items, the safer guides. We ask them to revise them or make them not a requirement, but if they revise them in a way that it's not burdensome, then that might not need to go. But there's other little things without the payment regulations, I think, that like a bunch of new ECQMs, electronic clinical quality measures.
Thank you.
Yes. So they might want to just, we asked for like one new one per year. So there are a lot of money and a lot of work to implement. So they might have that, but that's why we reach out to our members and see what they say. And
which of the reimbursement programs do you see being at risk?
Not at risk so much, but through the notice and comment rulemaking process, every year we have those payment regulations. The inpatient prospective payment system, IPPS, is our big one for us, how they're reimbursed and what they need to do, like under the Promoting Interoperability program. And that is where the administration tends to make their mark. Like last Trump administration, it was patients over paperwork. So we saw a lot of that in the payment regulations because those are a sure thing, like death and taxes. They come out every year at around the same time. And then the final rule comes out every year at around the same time. So that's where they kind of can make their mark pretty quickly.
Mari, anything to
I'm
add?
back.
I was just mentioning how in IPPS they can make their mark on.
Well, I personally hope they bring more broadband to Stafford County. So that would be my hope and wish for the next
All
administration.
podcasters wish for the same. Thank you very much.
Right.
Yeah.
Right.
Just outside of Kalamazoo, Michigan, my parents are pleading for it.
So, I mean, it goes, I mean, we're joking about it, but I mean, rural is another thing that's become, I mean, it's always been important, but it's
super hot.
Everybody is just saying it over and every possible, AI, cybersecurity, interoperability, everything. I mean, are there things in the docket that are related to that? I mean, we see that CHIME has a relationship with a program that Microsoft and Nordic are doing, I think, on rural. Where do you see legislation in that area going?
Yeah, I mean, again, the challenge is going to be honestly like the funding issue. I think there's a lot of interest, right? But there's a lot of things that compete for money in Washington, and you might have like a really good argument, but it's still very hard to come up like the cyber grants that we were talking about earlier. That in a piece of legislation, there's a lot of bipartisan support, but however, getting it over the finish line is very hard, and it's also not just like simply rural. It's also underserved providers or hard, under-resourced, like LTPAC, long-term post-acute care. They never got EHR money. So it's going to be very hard to fight for money in 2025.
We'll fight for it, though. Don't get us.
But we will. We will be fighting very, very hard.
Absolutely fighting for it with claws out. But I think people don't realize sometimes that there are points of care for maternal health and things like that. If you have to drive 2 hours for a checkup, you're not going to do that. So keeping hospitals open,
you need broadband. You need broadband for AI, right? I mean, these are
a lot of. You need a lot of.
You need a lot of energy.
Well, you need it for remote monitoring as well. It sort of brings up my teaser, and you know that I have this passion for hospital at home. And I'm just wondering if you've heard any rumors of whether that waiver bill for reimbursement for hospital at home will survive the end of the year.
If it gets, I saw this question. If it gets included in the end of year package with the telehealth extension, as it should be included in there, but the package has not yet been released. Probably sometime this week or this weekend when they reach a deal, but. Yeah, it hopefully will be in there.
So telehealth is in that bundle as well.
Yes,
Yes.
as well as
Last question, because we got 2 minutes left to go so fast. Anything on the Supreme Court side that could be a game changer?
I mean, I think we'll be looking for Chevron to be tested.
Okay.
that will be interesting to see how, they direct agencies and how much freedom they give them and how that will fall in line with the Chevron doctrine.
Interesting.
I mean, this isn't at the federal level, Frank, but the states are starting to fill in the spaces where privacy and AI federal legislation hasn't covered it. So I think there's going to be a lot of activity, and we don't do too much on the state level, but the states are picking up the ball and running it with it on AI and privacy.
Interesting. So we have 1 minute left. I mean, given the chaos of an election and administration change like this, I mean, you guys must have to rebuild a large part of what used to be called a Rolodex. I mean, is this, heavy lifting period for you to start finding the right players, or do you know where the suspects are?
I'd like to say I'm older-ish, Frank. This is not our first day at the rodeo. Okay, yeah. So it's just, it's a lot of,
occupational hazard. Yeah,
it's a little bit harder with like Zoom. You do have to get out and really try to get to in-person meetings and go up to the Hill. And it's interesting with the administration. Like right now, still so many people work remotely, but somehow we managed to like establish relationships during the pandemic.
That's great.
We did it.
That's great.
We'll do it again.
Did it before the pandemic, did during the pandemic. We'll do it now. Like it's just, sometimes it's still cold emailing and just introducing yourself.
Yeah. And honestly, like offering your members up as a resource, that's a huge value add. Like we're their voice in Washington. We can get them on the phone or in front of a policymaker. It's huge.
Well, we love the work you do, and I'd like to thank you again for being with us on Health Stealth Radio. You're always welcome. I'm sure we'll have some very exciting updates right after the first of the year. So we want to come back and see what you're seeing in reality versus what we're predicting. So thanks again to both of you. It's always a blast.
Thanks, Frank. Always a good time. Appreciate you.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.